If you're concerned about prostate health, particularly if you're dealing with an enlarged prostate, understanding your PSA levels is crucial. In today's video, we'll break down what PSA levels are, how they change with age, and what's considered normal, especially if you're experiencing prostate enlargement. Let's dive in. First off, let's dive into what PSA really is. PS, a short for prostate-specific antigen, is a protein that's produced right in the prostate gland. Now, having some PSA in your blood is perfectly normal. It's just a part of how your body functions. But here's where it gets interesting. PSA levels can fluctuate based on a variety of factors. Think of it as your body's way of signaling what's going on with your prostate. For instance, as we age, it's common for PSA levels to rise naturally. The size of your prostate also plays a role. A larger prostate might produce more PSA, and if your prostate is enlarged, something that happens to many men as they get older, those levels can be even higher. So, while a PSA test can be a helpful tool in assessing prostate health, it's important to understand that these numbers aren't one size fits all. They can vary from person to person, depending on a range of individual factors. Let's dive into how PSA levels naturally change over time, and what it means if you're dealing with an enlarged prostate, a condition known as benign prostatic hyperplasia, or BPH. Now, it's normal for PSA levels to gradually increase as you age. However, when you throw BPH into the mix, things can get a bit more complicated. Think of it like this: as your prostate enlarges, which is common as men age, it's like adding more cells that can produce PSA. So, it's not surprising that men with BPH might see higher PSA levels compared to those with a prostate of average size. But what does higher really mean? Let's break it down by age group. Age 40-49. In this age range, PSA levels are generally expected to stay under 2.5 ng/ml. However, if you're experiencing BPH, it's not unusual for these numbers to be slightly elevated. Age 50-59. As you move into your 50 ES, a PSA level under 3.5 ng/ml is considered normal. But again, BPH can cause these levels to rise above the average. Age 60-69. For men in their 60s, a PSA level under 4.5 ng/ml is typical. But if your prostate is enlarged due to BPH, don't be alarmed if you see a moderate increase in your PSA numbers. Age 70-79. As you approach your 70 SA, a PSA level under 6.5 ng/ml is what's generally expected. Yet, with BPH, these levels can be elevated beyond this range. What's crucial to remember is that while these numbers provide a guideline, they don't tell the whole story. PSA levels can be influenced by several factors, including the natural aging process and prostate enlargement. That's why it's so important to work closely with your healthcare provider to interpret your PSA levels within the context of your overall health. Let's break down why PSA levels tend to creep up as you get older, especially if you're dealing with an enlarged prostate. As men age, the prostate has a habit of growing larger, a common condition known as benign prostatic hyperplasia, or BPH. Picture your prostate as a balloon. When it's small, it releases a certain amount of PSA into your bloodstream. But as that balloon inflates, it starts releasing more and more PSA. That's why, as the prostate enlarges, your PSA levels naturally go up. It's not just a random spike, it's your body responding to the increased size of your prostate. So, if you notice that your PSA levels are higher than they used to be, it could very well be a sign of this natural growth process. It's one of those things that comes with the territory of getting older, and while it can be concerning to see those numbers rise, understanding the why behind it can help put your mind at ease. While these ranges give you an idea of what's normal, it's important to remember that elevated PSA levels don't necessarily mean you have prostate cancer. If you have an enlarged prostate, higher PSA levels are common, but it's crucial to consult with your doctor to interpret these results. They'll consider other factors like your medical history, the rate at which your PSA levels are rising, and any symptoms you might be experiencing. If you're living with an enlarged prostate, regular PSA screenings are key to managing your health. Starting around age 50 or earlier, if you're at higher risk, your doctor may recommend routine PSA testing. Keeping an eye on your PSA levels can help catch potential issues early and guide your treatment options. Maintaining a healthy lifestyle can support your prostate health and potentially keep your PSA levels in check, even with BPH. Here are some tips. Eat a balanced diet, rich in fruits, vegetables, and healthy fats. Stay active with regular exercise. Avoid smoking and limit alcohol intake. Manage stress, as it can impact overall health, including your prostate. And that's a wrap on understanding normal PSA levels by age, especially if you're dealing with an enlarged prostate. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe for more prostate health tips. Have any questions or topics you'd like us to cover? Drop them in the comments below. Thanks for watching, and take care of your health.